Good morning, my name is Emma Ray and I'm going to be your nurse today, but first I'm going to wash my hands.
Good morning.
Okay, I'm going to provide privacy. Can you confirm your name and date of birth?
Abby Fuller, May 7th, 2002.
Okay, and I will compare that to the medical record and it matches. I do want to let you know that you have the right to refuse this assessment, and if any point you don't want this assessment, just tell me. And also, anything that goes on during this assessment is confidential.
Okay.
Okay. Can you tell me your name?
Abby,
Can you tell me your birthday?
May 7th, 2002.
Okay, where are you?
Starkville.
And what season is it?
Fall.
Okay, can you raise your right arm? Okay, can you put it down? Now raise your left arm. Okay, put it down. Okay, so patient is awake, alert, and oriented ×3. Her speech is clear for her age. Now I'm going to check your pupil size. Okay, her pupils are 4. Now I'm just going to shine this light into them, okay? So I'm going to check her reflexes. Okay. Okay, there is a direct and consensual response of the eyes. I want you to focus on my nose, okay? And when I put this pen in front of it, I want you to look at the pen. Okay. So her pupils are perla. They are equal, round, and reactive to light and accommodation. Do you mind standing up for me? Okay, we're going to walk over to the Snellen chart, and this is just going to test your visual acuity. Do you wear corrective lenses?
I do in my right eye.
Okay, and she would be standing 20 feet away from the chart. Okay, can you read this first line?
E,
Second,
FP,
third,
TOZ, LPED,
okay,
PECFD,
okay,
EDFCZP,
okay,
FELOPZD,
okay,
DEFPOTXC.
okay. So you got majority of all of those right. So you have 20/20 vision bilaterally. Now can you cover up your left eye? Okay.
I can't read that.
Okay. So she has 20/200 vision of the right eye. And patient does state she has astigmatism of that eye. Can you cover up your other eye? Okay.
E, FP, TOZ, LPED, PECFD, EDFCZP, FELOPZD, DEFPOTEC.
Can you read the line below that?
No, ma'am.
Okay. So she has 20/20 vision of the left eye. So now you can go and sit back down. While she's walking, I'm observing her gait, and it is normal and steady. Okay, now I'm just going to inspect your ears. Is that okay?
Mm-hmm.
Okay. So she does have 1 piercing, 2 piercings in the right ear. The ear is free of any scarring or lesions. The skin color is normal for her race. Now I'm going to check her left ear. It is also free of scarring and lesions. It has a normal skin color, and she has 2 piercings in it as well. Both of her ears are aligned with the outer canthus. Now I'm going to check your nose, okay? So her nose is symmetrical. It's midline. There is no abnormal lesions or scarring. Do you mind tilting your head up for me? Okay, her septum is midline. Her nasal mucosa is moist and pink. Turbinates are present, and her nares are patent. Do you mind if I take a look at your mouth? Okay, can you open up? Okay. All teeth are present. Gums are moist and pink. Oral mucosa is also moist and pink. No dental caries. Can you raise your tongue? Okay. Sublingual cavity is present. Palate is also intact. Can you say ah? Uvula is midline and rises with phonation. Do you have tonsils?
Yes, ma'am.
Okay, I'm gonna check those, okay? Okay, so tonsils are a 1+. Do you mind if I check your gag reflex?
I'd rather you not.
Okay, I would do this by putting a tongue blade on the middle of her tongue, and that should elicit a gag reflex. So now I'm just gonna inspect your neck, is that okay? Okay. So her neck is a normal skin color. There are no abnormal lesions or scarring. I see no abnormal lumps or masses. Do you mind if I palpate your carotid artery? Okay. Okay, carotid artery is present. It's a 2+. Carotid artery is also present and it's a 2+, and there were no visible pulsations. I'm now going to auscultate for bruits, and I'm going to do this with the bell. You mind holding your breath? Okay, no bruits noted on the left side. Hold your breath. Okay, no bruise noted on the right side. Now I'm going to inspect your posterior chest. Okay. So skin on the posterior chest is intact. There are no lesions or scarring. There are some moles present. Okay. Now I'm going to palpate for tenderness. Is that okay? My hands may be a little cold. No tenderness?
No tenderness.
Okay. Now I'm just going to listen to your breath sounds. Take deep breaths. Okay, great. Breast sounds are clear and unlabored. There are no adventitious sounds, no wheezes, crackles, or stridor. I'm now going to percuss for CVA tenderness, and Miss Abby, this is just going to check to see if you have any pain in your kidneys, okay?
Okay.
So I'm just going to feel right here. Any tenderness?
No, ma'am.
Okay. Any tenderness?
No.
Okay, no CVA tenderness noted. Now I'm going to come back around and I'm going to inspect her anterior chest. Okay, so her skin is intact. It is appropriate skin color for her race. There is appropriate chest recoil. I'm going to inspect now her respirations. And I counted for 15 seconds and got 3. I would multiply that by 4, so that would be 12. Her respirations are 12. Now I'm just gonna auscultate her breath sounds. Is that okay? you mind if I go under your sports bra? Okay, breast sounds are clear, even and unlabored. She has a normal respiration. Now I'm going to do your heart sounds, is that okay? And I'm going to start with my diaphragm. So first I would go to the aortic valve. That's at the second right intercostal space, just right of the sternum. Now I'm going to go to the pulmonic, and it's on the second left intercostal space, just left of the sternum. Now tricuspid. And now mitral. Okay, S1 and S2 were present. There are no murmurs or S3 or S4s. I'm now going to test your arm strength and your range of motion. So if you will, I'm going to press down on your shoulders and just shrug up. Okay. Now I want you to squeeze my fingers as hard as you can. And I'll do your hands like this. I want you to spread them out. Now I want you to do your hands like this. Okay, now I want you to push against me. Okay. So strength in the shoulders, hands, and arms is a 5 out of 5. Now we're going to do range of motion. So for your fingers, I want you to spread them like this, and I want you to touch each finger. Okay. Can you open and close? Okay. Now for range of motion of the wrist, can you go down? Up. Okay, great. Now I want you to take your elbows like this, and I want you to stand and flex. Okay, and you can put them by your side. Now I want you to abduct, adduct. Now do it to the front. Okay, and extend back. So client has full range of motion for the hands, wrist, elbows, shoulders. Now I'm going to go back to her heart sounds, and I'm going to listen with my bell. And I'm going to listen in the same aortic, pulmonic, tricuspid, and mitral. Again, S1 and S2 present, no murmurs or S3 or S4s. Do you mind laying down on the exam table for me? Okay, now I'm just going to get your apical pulse. Okay, I counted her apical pulse for 15 seconds and multiplied it by 4 and got 64. So there is S1 and S2 present, no adventitious sounds, no S3 or S4. Now I'm going to palpate for the apical pulse. Apical pulse is present. It's a 2+. Now I'm going to observe her contour of her stomach. Her stomach is symmetrical. Her umbilicus is midline. She does have some freckles on her stomach. I'm now going to auscultate, if you don't mind. Just going to listen to your bowel sounds. I'm going to start in the right lower quadrant and pull your shorts down, okay? Okay, patient has normoactive bowel sounds in all 4 quadrants. If there were no bowel sounds present, I would listen for 5 minutes. I'm now going to lightly palpate your abdomen. Is that okay? Just tell me at any point if you have tenderness, okay? Is that okay?
No tenderness.
Okay, now I'm going to deeply palpate it.
No tenderness.
Okay. And while I'm on your abdomen, would you mind if I checked your femoral pulse?
Actually, I would rather not.
Okay. The patient deferred femoral pulse, but if you would like to check it on yourself at home, you can just use these 2 fingers and check it in your inner thigh at your groin. Now I'm going to begin on the lower portion of your exam, but first I'm going to start with the brachial pulse and the radial pulse that I forgot to assess earlier. So I'm going to assess those right here. And they are 2+, bilaterally. Radial pulses are also a 2+ bilaterally. I'm now going to inspect her legs. There are no varicose veins present, no abnormal lesions, no abnormal lesions on the foot or toes or the sole of the feet. Okay, there is no hair distribution. She states she has shaved. The temperature is warm. I'm going to assess her for edema. There is no edema, so that's a grade 0. I'm now going to do range of motion on your legs while we're laying on the exam table. So can you plantar flex and dorsiflex your feet? Okay. Can you wiggle your toes? Okay, so full range of motion for the ankles and the toes. I'm now going to get you to bring your knee to your chest. Okay. Other leg. Okay, so full range of motion for the knees. Can you now bring your legs out? Okay. And abduct the other one. Okay, so full hip range of motion as well. Do you mind sitting back up on the table for me?
No.
Okay, thank you. Now I'm going to get your popliteal pulse. Okay, popliteal pulses are bilaterally and they're a 2+. I'm going to pull your feet out. Okay, I'm going to get your dorsalis pedis. Okay, pulses are a 2+. I'm now going to get the tibial pulse. And they are equal and bilateral as well, and also a 2+. I'm going to get your capillary refill on your 10 toes. Okay, and can I get your capillary refill for your fingers? Okay, great. Now I want you to push against, so capillary refill was in less than 2 seconds for the fingers and the toes. That's normal. Now can you push your legs against me? Okay. Now pull. Great, so leg strength is a 5 out of 5. Now if you will, stand up for me and try to bend over and touch your toes. Okay, so while she's bent over, I'm gonna assess her for scoliosis. There is no lateral curvature of the spine, no hip or shoulder deviation, so her scoliosis test is negative. You can sit up. Now go back for me and side to side. Okay, great. So full range of motion for the spine as well. This completes our exam.